Most people have heard of the G-spot. But if you ask what it actually is, the answers are often inconsistent, sometimes even contradictory. So what are we really talking about? And how much of it is based on science? The idea of the G-spot comes from the work of a German physician, Ernst Grafenberg, who in the mid-20th century described a sensitive region along the front wall of the vagina. He observed that this area appeared to respond during sexual arousal and might become more pronounced as stimulation increased. Over time, this observation evolved into the popular concept of the G-spot, often described as a specific point located a few centimeters inside the anterior, or front, vaginal wall. Some individuals report that stimulation in this region feels distinct. It is sometimes described as deeper, more pressure-based, and different from external stimulation. However, this is where the discussion becomes more complex. There is still no full agreement within the medical and scientific community that the G-spot exists as a single, clearly defined anatomical structure. Some studies suggest that there may be a localized sensitive area. Other research indicates that what people are experiencing may not be one structure, but the combined effect of several closely related anatomical components. To understand this properly, it is important to look at the surrounding anatomy. The clitoris, which is often thought of as only an external structure, actually extends internally. It has branches, known as crura, and associated erectile tissues called vestibular bulbs, which run along the sides of the vaginal canal. Near this same region, you also have the urethra and a set of glands commonly referred to as the Skene's glands. These glands are sometimes discussed in relation to female sexual physiology, although their exact function continues to be studied. Because these structures are positioned close together, stimulation of the anterior vaginal wall may simultaneously affect multiple tissues. For this reason, many researchers now describe this region not as a single spot, but as part of a broader functional area. This is sometimes referred to as the clitorourethrovaginal complex. In practical terms, this means that what is often labeled as the G-spot may actually be a coordinated response involving several interconnected structures. This helps explain an important point. Experiences vary significantly from person to person. Not everyone reports sensitivity in this area. And from a medical perspective, this is completely normal. For many women, the most consistently responsive and well-documented area of sensitivity is the external part of the clitoris, which contains a high concentration of nerve endings. So if stimulation of the anterior vaginal wall does not produce a strong response, it does not indicate a problem. It reflects natural variation in anatomy and perception. Now, a related question is often asked. Do men have a G-spot? In popular discussions, the prostate is sometimes referred to as the male equivalent. The prostate is a gland located just below the bladder, surrounding part of the urethra. Its primary role is to produce fluid that contributes to semen and supports sperm function. While some individuals report sensitivity in that region, the prostate is not classified in medical anatomy as a G-spot. There is no officially defined structure in male anatomy that directly corresponds to the concept of the G-spot as described in women. So from a scientific standpoint, the answer is no. Men do not have a G-spot in the same anatomical sense. Taking all of this together, a clearer understanding begins to emerge. What is commonly described as a single point is more accurately understood as part of a complex anatomical system. And recognizing that complexity is important. It allows us to move away from oversimplified ideas and toward a more accurate understanding of the human body. Because the goal is not to fit into a specific expectation. It is to understand how the body actually works. If you want more clear, accurate explanations like this, subscribe to SenseIt.